Okay, wonderful. Good morning, everyone, and welcome to our informational workshop on licensure tiers. My name is Lynn Currier Stanley, she, hers. I'm the Executive Director of NASW New Hampshire. I'm here with Lindsay Courtney, who is the Executive Director of New Hampshire OPLC. We know that this is kind of a big change in addition to our licensure tiers, and wanting to make sure that everybody has some of the information that they need for themselves and also for their organizations, because we do believe it'll have a pretty big impact and hopefully a very positive impact on our organizations and the professional development of our workforce. So to start off, why tiered licensure? And this came about 3 years ago, and recognizing that we have a lot of people in emergency departments, and I'll say we, but this is mostly New Futures that did a lot of the heavy lifting. Michelle Merritt in collaboration with Senator Bradley. Noticing that a lot of while the adults who were waiting in emergency departments for psychiatric hospitalization, most of those individuals have Medicaid, and the community mental health centers have a waiver with Medicaid so that any service provided by anybody, master's, licensed, whatever, can be billed to Medicaid. However, most of the children who were waiting in emergency departments for psychiatric hospitalization were on their parents' private insurance. And private insurance will not allow for the billing of services for anybody who is not licensed. Also in Medicaid for outside of community mental health centers, Medicaid will not allow for the billing of services for non-licensed people. So let's create some licenses so that the service is provided by some really crucial services provided by some very talented individuals and service providers can actually be billed. Also, licensure assists with professional development. Right, when you have done the things that you need to do in order to show, yeah, I know what I'm doing and I'm providing these services and they are important services, that helps for those professionals to see themselves as professionals and for their organizations to see themselves as professionals, and maybe help move up the professional ladder, maybe getting the next step in your education, maybe moving on to a higher licensure tier. But it starts oftentimes with that another licensure tier. So I'm going to, and I'm also going to say that we will have plenty of time at the end to do questions and answers. And Lindsay, I'm right now making you co-host so that you can keep an eye on the chat.
Oh, perfect.
So the first licensure tier, LSW, Licensed Social Worker. This is pretty straightforward. This is for people who have attended and graduated from an accredited BSW program. In New Hampshire, we right now have 2 of those, one at UNH, one at Plymouth State. St. A's is working towards it, but those are accredited BSW programs. There would be a supervision agreement, just as with an LICSW or a LCMHC or an LMFT, that gets approved by the Board of Mental Health Practice. There's then that 2 years of supervision, working in an agency, an hour a week, so totaling 100 hours of supervision. Once the agreement is on file, we now have that conditional licensure. So from the time that the agreement is on file until The final application is approved at the end of the 2 years. The letters after your name would be LSW-C. There is right now the ASWB BSW exam that would be required, and then the application at the end of the 2 years to get that license. So that is fairly straightforward, and any questions we'll get there. The other caveat that I'd just like to identify is this is brand new. This is just in effect since May 15th. And we don't know what we don't know. We can see, oh, here's some things that might be problems. Here's some things that might need to be changed. What we're working with right now is what we have right now. But that doesn't mean it's written in stone. Over the next however long, we might say, hey, this is a barrier. Is this really necessary? Let's change this. And then we either work legislatively or within rules to change it. So just putting that out there. The LSWA is the Licensed Social Work Associate. Sorry, that's a typo. It should be not social worker. It should be social work. Licensed Social Work Associate. This is for people who have attended a program other than a BSW program. They might have their associates, they might have their bachelor's of arts, they might have their bachelor's of science in something else, human services, psychology, sociology, just to name a few. So for somebody who has their bachelor's, again, a supervision agreement would go on file and be approved by the Board of Mental Health Practice. They would receive 2 years of supervision from somebody who does have their license in LICSW and LCMHC or an LMFT. If somebody has their associates, it's 3 years of supervision, so 150 hours of supervised practice. And then for both bachelor's and associate's degree people, there is the ASWB exam. It is right now listed as the bachelor's exam. It is our understanding that ASWB no longer has the associate's exam, but we're looking into it because if there is a way for people to take an associate's exam, it would make more sense to do that. For somebody who has a bachelor's, it's 4,000 hours of work. For somebody with an associate's degree, it's 6,000 hours of work. So 2 years versus 3 years. Right now, I'm going to stop my share in just a second to pull up the Board of Mental Health Practice website, but recognizing for LSWAs, one of the requirements sometime in between getting your supervision agreement on file and getting your full license, your LSWA license, there is 30 hours of prescribed training prior to full licensure. It is unfair, all right, in my opinion, it is unfair to hold people to social work code of ethics, mission and values without having any training in social work, mission and values and ethics. So this will be a prescribed training that will cover the competencies listed by the Council of Social Work Education. NASW New Hampshire is currently creating that training and creating a toolkit so that organizations can use it, use the curriculum, use the training materials. We will be holding it as well. We'll be doing some beta testing to see what works, what needs to be changed. If you'd like to be a part of that, we'll keep you apprised. But this is a part of rules that there's this 30 hours of prescribed training to meet that address social work competencies. All right, I am going to stop the share for a second. There we all are. Give me. Courtney, do you want to guide us through some rules?
Yes, absolutely. So you're looking for the actual board rules establishing the requirements for these licensure tiers. That's going to be under the board information page on the right, under laws and rules. Now, the legislature has not yet updated their website, the GenCord website, to incorporate the new rules. So you're going to find those under recently adopted rules, and that's MHP 305, starting with MHP 30502. That's where you will find those rules. In terms of the actual application itself, Lynn, I don't know if you want to go back to the mental health
but
practice
so you
role.
can see, this is where, if I could just like, I am constantly on this page.
Yes.
So if you're looking up where the rules are for initial licensure, they're all under the 300s right there. And you can see, and this is where I've gotten a number of emails saying, why did they, oh my gosh, they changed the rules for clinical social workers. There's a listing for clinical social workers. There's a listing for social worker. This would be your BSW. And then here's the social work associate. So there's the 3 different types, just so when you're looking, you know that you're looking under the right place. And now back, you want me to go under applications?
Yes, that would be helpful.
Did it change for you?
Yes, so we tried to break it out based on license types, what the requirements are going to be, with a link to the documentation. So if you scroll down, you'll see the new license types that have been added under these rules, the social work associate and the social worker, as well as the conditional licenses. To the right, you'll see what you need to do, what documents you need to obtain in order to submit the license application. Now, it is still a paper document, unfortunately, and we can get into this if you have questions later on. But right now, we are accepting the applications in paper format with the transcript sent directly from the institution.
Okay, and if I go back to mental practice, the supervision agreement, I always have trouble finding this, but it's actually under education, correct?
Yes.
So this is where you'll find the request to sit for the ASWB exam once you've done 18 months of your supervised practice. Continuing education and collaboration report. But right here, the candidate for licensure supervisory agreement. This is what gets filled out. Oh, I'm sorry, I didn't open it, just download it onto my computer. This is the agreement that you as the supervisee and your supervisor will fill out to submit to Board of Mental Health Practice for approval. Anything else on this website that we should be looking at, Lindsay?
Yeah, the only other thing I would note is that the fees are in a different place. So you can find them in a couple of, in 2 different areas. One would be under license information and license fees. So if you click on that, those are going to be specific to the Board of Mental Health Practice. And this makes clear that your board falls under the Professionals Health Program as well. So there's that additional requirement. If you wanted to see the rules that establish the fees, If you scroll up, Lynn, you can go to just laws and rules on the toolbar. You can go to OPLC rules. And then if you scroll down to, I think it's the 1000s,
Geez,
all
that's
of
a lot of scrolling.
yeah, all of our rules are in the PLC one, or all of our fees are in the PLC 1002s. So you can click on the chapter PLC 1000s and you'll see all of the fees. As a side note, we are working on updating the fees, and I suspect your fees will change, likely be reduced. But for now, these are the fees that are in effect. I think those are the only other things on the website that I think it's important for a candidate to be aware of when they're applying for a new license.
Did the screen change for you to the?
It did.
Good. Okay, so we just looked at the application. Now waivers. And I hand it over to you, Lindsay, to talk about waivers.
Yeah, and there are a couple of questions in the chat, I think, that relate to this, surrounding, blanketing in of people who have been practicing for a long time, particularly as it relates to the supervision requirements. So the statute setting forth the new licensed tier, social work associate and social worker, do have a statutory requirement of having supervised practice. In the rules, the board further clarifies that they want that approved supervision agreement on file. But what do you do if you've been practicing for 10 years and you've been supervised, but you did not have an approved supervision agreement? The board rules do have the opportunity to request a waiver of substantive rules, and that's in MHP 213. And essentially what you would have to do is you would have to submit a request to the board asking for a waiver of the rule that requires supervision agreements to be on file with the board if that's what you're seeking to waive. And you really just need to explain how complying with the rule as it stands would cause you hardship. And then the board would take that into consideration. They would make a decision, and if they grant you the waiver, you would not need to show that you had a supervision agreement on file in order to sit for the examination. So that's how you would go about essentially bypassing that requirement if you've already been practicing, particularly for a substantial period of time. And that's a determination that will be made by the board.
I think the thing to keep in mind is that waivers can be requested for rules. They cannot be requested for things that are in statute or law, but things that are in rules, you can request a waiver.
Correct. So anything that's in statute cannot be waived. Obviously that requires a statutory change, but in rules, the board has discretion provided that you show there's some sort of undue burden, hardship, or there's otherwise good cause for waiver of the rules that's really unique to your circumstances. That's what you would want to demonstrate.
Now, question and answer time. So I'm going to stop the share. All right, I am going to first of all look at what's in the chat to see what hasn't been addressed yet. But if people want to raise their virtual hand, then we can call people. We'll be able to get a copy of the slides. Yeah, you can get a copy of the slides. This recording will also be up on the NASW New Hampshire website, probably under licensing information. I haven't figured out exactly where it's going to go, but within a few days. We've got the in retroactive documentation. The question about the rules for supervising, yes, you will need to be a board approved supervisor, which means that you've held your license for 2 years and that you either took a supervision course in graduate school or 12 hours of supervision, 12 hours of supervisor CEs. And how will people know which license to apply for if they are new to this? Is there something that'll be available on the NASW website or board website that describes? Yes, we will have, and really this is about me figuring out what it's going to look like. But yes, there will be information on the NASW website about which license you'd be applying for, and how to go about doing that. But a lot of it's going to be linking back to the OPLC website. Do we have feedback from private insurance payers regarding their agreement to reimburse for these new types of licensure? Do other states have these similar licenses and private insurance is reimbursing? See, it's all different because Medicaid is different state to state. I would suggest that whoever does the billing for your organizations connect with Medicaid, connect with private insurance. We do know that in Massachusetts and in Maine, they also have licensure tiers. Many other states have licensure tiers, and are able to bill. They're not able to bill for psychotherapy codes, but they are able to bill for counseling codes, case management codes, and other codes. Choose which type there is. It the same candidate for licensure supervision agreement as the LI? Yes. It's the same, it's same exact supervision agreement. It will look different, obviously, for an LSW or for an LSWA, based on what your supervision goals are. Is there a license level someone can obtain after completing their MSW and before they get their LICSW? Right now, once you have your supervision agreement on file, you qualify. If you're working towards your LI, you get your supervision agreement on file, you are now an LICSW-C. Lindsay, I'm correct in those letters?
Yes.
Okay.
Yes.
Meaning conditional. So you will hold your conditional license for those 2 years while you're working towards. And that's the same for all, whether you're MFT, you're a marriage and family therapist, clinical mental health counselor, social worker, school social worker, bachelor's level social worker, or LSW, licensed social work associate. That time in between getting your supervision agreement approved and on file and getting your full license, you are now -C for conditional. So you will have that L after your name.
Now, Lynn, the only thing I wanted to add to that is we don't currently in New Hampshire have the category for non-clinical MSW educated individuals. They would have to utilize the licensed social worker category. And looking at other states, that category is pretty small in terms of the number of states who offer that. But that would require legislative change in order to make that happen if there's an interest there.
Yes. Once an MSW has completed and filed an approved supervision agreement, how long do they have to take the exam? You can't sit for the exam until you've been supervised for 18 months. But I don't, Lindsay, is there a time limit?
I'm not aware of a time limit, except that the conditional license can only be renewed once.
Okay. So that is kind of a time limit.
Yes.
With an MSW, can I take my exam before supervision? No, the supervision, if you are sitting for your clinical exam, you need to have had a 1.5 years of clinical supervision, be a licensure candidate for 18 months. And then you can request to sit for the exam. Yeah, Kara, the changing of the letters. This was the LICSW letters got changed to LCSW as kind of a statutory cleanup, but there's legislation that has, I believe, passed the House and Senate waiting for governor's signature that basically gets our letters back. So continue using LICSW, and legally our letters will come back to that soon. Okay, you guys are all just putting your questions into the chat. Individual has a BSW, is in supervision for LADAC and is in the midst of an MSW program. What should they be applying for? If somebody has their BSW, then they can apply for their LSW. If that makes sense for them. If maybe the organization that they're working for says, hey, we'd really like to be able to bill for your services. Can you get your LSW-C? That once they have their MSW, right? Because they should be getting their MSW in a little over a year if they're advanced standing. They may be only holding on to their LSW-C for a short amount of time before then going in and applying for getting their supervision agreement on file for their LICSW. And as far as a conditional license, what does that mean for billing? That depends on your organization, the insurance company, and what you're billing for.
Lynn, can I jump
Yes.
in? Sorry, it's Genevieve.
Absolutely.
Before we get too far from the original question, I don't want it to be random. Kara's question about LICSW now being titled LCSW, and then you saying, we're in the process of getting our I back. On I just checked, on our actual licenses on the piece of paper, it just says clinical social worker. Will we have to do anything, or just at renewal, potentially it'll say, licensed independent clinical social worker or something like that?
Lindsay,
Yeah,
you get the
I
tough
can address
questions.
that. Yeah, so at the office, we've been doing a bit of cleanup to ensure that we're complying with statute and rules. And your statute, although the practice has been to use LICSWs, has referred to your license type as clinical social worker, which is why the current licenses reflect that title. Obviously, there is a legislative change to change that, which we don't have any concerns with that. So once that statute is passed, assuming the governor signs it, we would just make that change in the system. You could wait until you renew and get a new license, or you could just request one and we can send you a new license electronically. Or when we eventually, hopefully this fall, migrate your profession over to the new licensing platform, you'll be able to go in and download your documents on your own. So there will be a couple of options available to you.
Thank you for that clarification. And one last question about this. I'm sorry to take up time.
No.
Is that going to be for a fee as well? We're going to have to pay to download our license, or to request a new one if it doesn't happen at renewal?
No, the only time you would pay is if you're looking for a fancy one on the wall. If you're just looking for one that you would typically get when initially licensed, then you would just, that's free. That's part of your licensure.
Thank you.
Not to put you on the spot, Lindsay, but we're required to put them up on the wall, right? We're required to have our license visible to clients. So of course we want a fancy one for the wall.
You don't want to see mine. Mine's like this small. And yeah, if you want a fancy one, we outsource it to a vendor within the state. And so I think it's $20 right now. And it's larger and it's suitable for framing. The other ones, some people are fine with those. They are modeled after Florida's licensure documents. So you can feel free to print those. And I think there's 3 versions. There's a small one, kind of a pocket card one, and then a regular 8x10.
Okay. So BSW with nearly 5 years experience working in the field as a case manager, wanting to get their LSW, how would you get started? And I would recommend, with 5 years of experience, you're going to request a waiver so that you're not starting at day 1 with your supervisor. So looking at the application for all the things that you need, and then submitting a letter. Lindsay, I'm looking for you for confirmation, saying I have
Yes.
this, and this. What I don't have is a supervision agreement that's been on file because it wasn't requested or required. Can I get a waiver? And this is the supervision that I've received. Can I get a waiver from having to have a supervision agreement on file? And if the board says yes, then you would request to sit for the exam, pass the exam, and then submit your license application.
Yes, and I think that's correct. And the one thing I would add or emphasize is that you can request waiver of the requirement to have on file the documented and approved supervision agreement. You can't request a waiver of the actual supervision. So you'll need to show, I think it would be helpful to you if in your letter to the board, you addressed how you otherwise obtained supervision. You just didn't have an agreement because it obviously wasn't required at that time.
Including the fact that you are supervised by somebody who is an approved supervisor, if that's the case.
If that's the case.
Question, does the LICSW-C allow you to do anything that previously wasn't allowed prior to receiving the LICSW? Meaning, what is the benefit of the conditional licensure? It depends on your organization, what gets billed, who can bill it. It may be a benefit to you. It may just be extra letters after your name. I received approval for my LSW to be reinstated in Maine. Just need a supervisor to sign off. Is this an exam? Is this an exam that might receive a waiver in? Allison, I'm sorry, I'm not quite getting your question.
Is this an example that might receive a waiver?
Oh, an example. Oh, I'm sorry.
Sorry,
I saw exam. I received approval for my LSW to be reinstated in Maine. Just need a supervisor to sign off. Is this an exam? Yeah, I think if you have that similar license in Maine and you want to get your license in New Hampshire, Lindsay, tell me if I'm wrong, but it would be by
Endorsement.
By endorsement, yes.
Yeah, so essentially you would apply under a different mechanism. It's called the PLC 313s are the rules. It essentially just fill out the application, universal application. You provide a documentation that you have a license in Maine, and assuming Maine has substantially similar requirements, we would just issue your license based on the fact that you have one in Maine.
Okay, thank you.
You're welcome.
And the question for MSW students, is it best to wait in going through the licensure process once they complete their program and work on their LICSW-C, or should they begin working on becoming licensed as an LSWA? My 2 cents is wait till after you get your MSW and do it that way. The only reason I think that you might want to get your LSWA-C is because the agency you're working for wants to try to bill for your services. That might be a reason why. There could be some, and I'm saying could be some implications for those paid internships. if your agency that you're now working for is able to bill for your services. But that's a conversation between you and your workplace and your internship and or your internship. But my 2 cents worth is, wait, you're gonna have to, you'll be doing all of this as soon as you graduate with your MSW. Are the new levels of licensure also good for 2 years like the LICSW?
Yes.
Yes. Confused about what an LSW can bill if they cannot bill for psychotherapy. It might be case management, counseling, and I believe that there are some others, but I think case management and counseling are the 2 that probably most would use. When thinking about scope of practice, the 3 things that an LICSW, licensed clinical mental health counselor, licensed marriage and family therapist can do that the LSW and LSWA cannot do: psychotherapy, differential diagnosis, top signature on treatment plans. For the LSW, for the LSWA, those 3 things are absolutely not within their scope of practice. If the MSW has completed the supervision hours within the 2 years of filing without filing any extension and has it on file that it was completed, is there a time limit on when they can take the exam, or can they take it a few years later? Lindsay, it sounds like you can, but you can't. You can only renew your LICSW-C once.
Correct. So the max you can have your LICSW-C is for 4 years. But if we have your application requirements on file or your documentation on file, you would just submit an updated application. We would rely on the existing documentation and process that.
Can LSW-Cs, LSWA-Cs be supervised by someone outside of their organization the same way that LICSW-Cs can be supervised by someone outside of the organization, as long as there is a contract between supervisor and organization? Yes, I believe. I'm looking at Lindsay.
Yeah, the board did add or make a modification when they updated their rules to exclude the contractor relationship. So in the context of providing supervision, I just want to pull it up so I can give you the exact citation. Don't know that it answers your question directly. And these rules were effective May 14th. And so when, for example, in MHP 30702I, it talks about the supervised work experience required for social workers. The board says essentially a 1099 contractor of an independent private practice is not considered acceptable supervised experience. So essentially what they're saying is it has to be in the context of an employment relationship. I don't know if that answers the question.
Right, but the work experience, they have to be an employee, a W-2 employee, and cannot be a 1099 independent contractor. However, the supervisor could be off-site.
Correct.
Because they're not, because that off-site supervisor is not their employer.
Right.
Lynn, does that answer your question? I want to make sure we've got.
It does. Thank you so much for
Okay.
clarifying. I appreciate it.
Oh, Emily, good point. So Lindsay, question for you. Did the rules actually get changed to say that you have to have worked for 18 months? Or is it still?
I don't see anything in the rules that says 18 months.
Okay. sorry. So so the whole 18 months thing has been kind of threatened for the last 5 years, but it's not actually in rules. So you could actually sit for the exam anytime after getting your supervision agreement on file.
Lynn, I should correct that. The new rules don't reference that, but the older rules do. What's interesting though is there's a question on the application as to whether you've completed at least 18 months of clinical supervision, but there does not appear to be a corresponding requirement, if that makes sense. So they asked the question on the application. My assumption is the practice has been to not allow somebody to take the exam if they answer no to that question, although I'm not seeing anything in the rules that definitely prohibits that. I think that's the intent of the board, but I guess it's somewhat vague. Sorry, it doesn't, that's not helpful.
No, the reason why I'm laughing is because I've been telling students, it's still, you can take it anytime, but it could change at any time, but we don't know if it's actually changed. Okay.
Right.
Emily, I wish we had a exact answer, but it sounds like maybe you can take it right after graduation.
Okay, so I should just have my supervisees try it. See if they get approved.
Lindsay, should they try it?
I mean, if it were me interpreting the rules, I would say, okay, this is interesting information. There's nothing in here saying we can't approve them. I think past practice of the board has been to not approve them. So, you know, I think that's probably the intent, although not expressly stated, and we can really only rely on what's expressly stated. So you could certainly have them try, but there are no guarantees that they will be approved.
Yeah.
And the question that I would have is, what's the benefit? I don't know. That's something that only you can answer. But what's the benefit of doing it before we're waiting?
Question is, if you were licensed and gave it up, how do you renew? And I'd say going back onto the OPLC's Board of Mental Health website, there is a section on renewing or reinstating. I think that's what it is reinstating your license.
Yeah, the important thing to remember there is you can reinstate for a year after you let your license expire. After a year, it's considered lapse, and you essentially have to start the process over again. Now, if we already have your information on file, like your old supervision agreement and your examination, then obviously we would use that information on file. But there are different requirements.
Okay, to clarify, can you be operating your own small business, not a W-2 employee of an organization, and pay for licensed supervision and have that qualify as supervision time? The supervisee, the licensure candidate cannot be employed as a 1099 employee. They have to be a W-2 employee. We can get into all the reasons why that is. Suffice it to say, it can be a real problem there for licensure candidates. So they have to be a W-2. However, if a licensure candidate is working for an organization where they cannot get supervision, they can get outside supervision from somebody who is private, if you will. However, if your organization takes on people as 1099 independent contractors, you cannot, the licensure candidate cannot be a 1099 employee. And please repeat the schoolwork that counts for associates. I'd look under the rules, but I mean, you're looking for something human servicey, and it's really about the courses that you've taken. You could have your bachelor's in accounting, I suppose, But if you've taken courses, the courses, and I don't have it right in front of me, but a certain number of credit hours in addictions, in human development, I'm blanking on the types of courses that might be taken, but there's a listing within rules and a certain number of credits. Julie, you have a question?
I do, and I don't know how to put it in writing, so this is easier. So I'm thinking about my students, Lynn. Is there any possibility, and I thought about because somebody asked about the question about is there any reason people should get the LSWA prior to if they're in the MSW program. So is there any possibility that we could see students entering their internships and that internship supervisors or hosts for internships or the sites for the internships would be saying that they would prefer to, is there any reasoning they would have to be seeking interns with an LSWA? Because typically right now we have the supervisors and we're covered that way, but are we going to start to see that there's a preference for seeking supervisees with an LSWA?
I don't know. There are many unknowns here, and
Yes.
I think this is one of those things that it'll be great for all of it, getting the information back about this works, this doesn't, this is a great thing about this is the trend that we're seeing. That's the information that I'm hoping we get that feedback loop on, because that will help guide our work in recommending rule changes and statute changes. Like I can tell you right off the bat, NASW will be putting forward legislation, getting a sponsor to get rid of the exam for LSWAs. All of the rules and everything, it all passed before the pass rate the demographics for pass rates came out. It does not make sense. It's a barrier. It's unfair. Let's get rid of it. But we have it for right now. It's in statute. We need to change it by statute. It might be, oh, look, organizations are really happy that people who have their BSW or in getting their LSW or their LSWA are really valuable, and organizations are really encouraging their student interns, their MSW interns, to get at least started with this process, because it benefits the organization, because they're now able to offer a stipend to their student interns. It'll be interesting to see over the next couple of years what happens. Courtney, you wanted to say something? It looked like?
No, I think you said it perfectly. I do have a couple of questions in the chat that were direct messages. I can read those off, Lynn,
please
if
do.
you'd like. The first one is, what does the conditional license allow someone to do versus somebody without the conditional license? I think you're asking about scope of practice.
Excuse me, that was mine, and I private messaged you first by accident, so it's already been answered.
Perfect.
Thank
No,
you.
not a problem. And then there was a second question. Will LSWAs who are licensed in Massachusetts have reciprocity, or can their supervision hours count towards licensure in New Hampshire without needing a supervision contract or conditional license period? That's going to depend on Massachusetts licensure requirements. We have not yet evaluated that. Assuming they're substantially similar, then you could certainly endorse into New Hampshire with a Massachusetts license. Those are the only two.
Okay. I think we've got all the questions in the chat. Are there any other questions? Mel?
I just wanted to thank you, Lynn, for recognizing me. I just wanted to clarify the scope of practice for the LSW and LSWA, because when I read the 330A, 18B, and subsequent for the LSWA, it says that they can evaluate, screen mental health disorders, co-occurring mental health and differential diagnosis, basically as long as it's signed off by a supervisor.
Yeah.
Then that they can also perform counseling, including individual, group, family, and significant other counseling. Is that different than psychotherapy?
Yes. Please don't ask me to describe it, but it is. But for the first one, it makes absolute sense that somebody who's a case manager, a family support specialist, they're going to see things and then talk to the social worker, the mental health counselor, the psychologist, the psychiatrist, whoever, saying, I'm noticing this symptom, this symptom, this symptom. Is this part of me, right? It's part of the conversation. But it is the LSW and the LSWA cannot give that actual diagnosis. That needs to come from the master's or doctorate level clinician. As far as the difference between psychotherapy and counseling, I get myself into trouble when I try to do this sort of thing. Generally, counseling is very simplistically helping people make decisions. Psychotherapy gets more into the modalities of treatment, the varying modalities of treatment. And if you were looking for a short and sweet, the why you make the decisions that you make.
Mm-hmm.
Right. And I know that's really oversimplifying. Please don't put questions, comments in the chat saying that's not what we do. But it's in World According to Lynn, the term psychotherapy is really quite antiquated and we need to be thinking differently about it, but that's a discussion for another day and not anything that the insurance companies want for us to cover right now, or we know that our bachelor's and associate's level human service professionals do an awful lot. We know that they do a ton of work, and they would not be fully supported. I mean, they wouldn't even be close to fully supported if we didn't have them. And so I'm really excited that we have these new licensure tiers so that we can recognize their work, not only professionally, but also financially. And I think at this point, we are almost at 11 o'clock. I am going to thank all of you for coming, and thank you, Lindsay, for being here to answer the tough questions. And I will also say that you know where I am. You've got my email. We will have something up on the website, the NASW New Hampshire website soon, not only with this recording, but with additional information. The OPLC Board of Mental Health Practice website is a fount of information. I mean, pretty much anything that you could need is right there. It's more about the devils in the details that you might want to email me or look at our portion of the website once it's up there. And again, I will implore you, please let me know how it's working. I can't We can do, NASW New Hampshire can do a ton of advocacy work, but we can't do the work if we don't know what the, not only the good stuff, but also what are the barriers and challenges we want for this to work for people. All right. Lindsay, thank you, thank you.
Thank you, Lynn. Thank you, everyone.
All right.
Appreciate your time.